Hello everyone, welcome back to another emergency technique from Nurses, the Heart of Healthcare. Keep learning, keep growing. My name is Shenaz and in this video we are going to learn one of the important emergency rescue procedure which is a well-known first aid procedure known as Heimlich Maneuver. Heimlich Maneuver. Not only medical professionals but also the non-medical people, the common people should be aware of this because it is a quick life-saving method. It can save the life of a person who's choking. So choking which can happen with anyone at anywhere, and if we are aware of this maneuver we can save the life by helping a person who's choking. Okay, so we must be aware of this and how to perform it, when and how to do it. Let's see that in the video. In this video we will see how to perform Heimlich maneuver in an adult, in pregnant ladies, in obese people, in children, in infants and in the person who's lying down. Okay, so before moving ahead, I would really appreciate that if you are new to my channel, please subscribe my channel, and if you find the content helpful, please do like and share my videos. So first thing that we must know is what is Heimlich maneuver. Heimlich is the name of the person who invented it, and maneuver means that it's something well trained, a skillful technique. Okay, so Heimlich maneuver, which is also known as abdominal thrust, it is an emergency rescue procedure which is used to treat upper airway obstruction by foreign objects. Okay, it is used to dislodge an object which is stuck in the windpipe and which is preventing the person from breathing. So Heimlich maneuver is a medical emergency procedure which is used in medical emergency like choking. He is Sir Henry Heimlich. He was an American thoracic surgeon and medical researcher, and he is widely credited as an inventor of the Heimlich maneuver, which was first described in 1974. So he is the one who invented Heimlich maneuver, which has become a well-known emergency rescue procedure. This is a universal sign of choking. Okay, and Heimlich maneuver is performed on the person who's choking. What is choking? Choking happens when an object lodges into the throat or the windpipe, blocking the flow of air. And the choking object can be anything. It can be a hard lump of food, it can be a marble, it can be false teeth, it can be a toy, it can be a battery, or any hard object which goes into the trachea instead of the esophagus and blocks the airway. And the blockage can be partial or complete. May it be a partial blockage or complete blockage, it is a medical emergency. And if we don't perform Heimlich maneuver and get the dislodged object, the person may become unconscious and we may even lose the person. So choking is a medical emergency and Heimlich maneuver is an emergency rescue procedure. If the object is at the entrance of the trachea, the epiglottis, okay, then with the help of a good cough, we will be able to push out the object. But if the object has made its way past the epiglottis, then coughing may not help. At that time we have to perform this life-saving technique called Heimlich maneuver to save the life of a person. Before performing Heimlich maneuver on a person you presume to be choking, you must confirm that the person is really choking. And how will you confirm that? You can confirm that by these signs. Okay, signs of choking. The person who is choking will not be able to speak, cough or breathe. Inability to speak, cough or breathe. They will be changed in the color of the face, from red turns to blue, and the person looks panicked with the eyes wide open, and with one or both hands he or she will be clutching their throat. Okay, and they may try to leave to a private area and acting to agitated or trying to get attention. So these are the signs of choking. And when you see a person presented with these signs and symptoms at home or anywhere outside, this shows that the person is choking and requires your immediate help. When you see a person in this position, okay, this is a universal sign of choking. Okay, one or two hands clutch around the throat, okay, and the person's eyes wide open, panic and starving for air. So this is a sign of choking. So when you see like this, then immediately you have to perform Heimlich maneuver. But before performing, always the person who's choking is already panicked. You should not get panic. So first thing what you're supposed to do, you should confirm that the person is really choking. Okay, how you will confirm that? You have to ask the person, are you choking? Okay, the person will not be able to speak, cough or breathe. Okay, then what you will do, you have to tell the person that okay, you're choking, I know what to do, let me help you. Okay, directly you jump on the person and try to perform Heimlich maneuver. The person will be already panic, and they may get more panic, like what is happening with me. Okay, so that's the reason it's very important to let the person know that you know how to help him. Okay, let's see how to perform Heimlich maneuver or abdominal thrust in an adult. To perform Heimlich maneuver in an adult, you have to stand behind the person. Okay, as you can see here, you have to stand behind the person and with one foot slightly in front of the other for the balance. Okay, and wrap your arms around the waist, and the tip the person forward slightly, means you have to bend the person slightly forward, and make a fist with one hand and put it just above the person's navel, means just right above the belly button and grasp the fist with the other hand. Then press into the abdomen with a quick inward and upward, as if you are trying to lift the person up. Okay, so this is how you are going to give abdominal thrust or Heimlich maneuver, and you have to repeat this movement up to 5 times and check if the if the choking object has been dislodged. If not, then you have to continue performing the abdominal thrust. In case if the person becomes unconscious, unresponsive, then you have to start the standard CPR. Okay, so this is how you are going to perform Heimlich maneuver in an adult. Okay, to perform Heimlich maneuver in kids, see, this is exactly the position of the hand. Okay, just above the belly button, just above the navel. Okay, right above the belly button, you have to put the wrist like this, in this way, and give abdominal thrust. Okay, inward, upward, please remember, inward, upward. And to perform Heimlich maneuver in pregnant ladies, okay, see, in pregnant ladies, obviously the abdomen is quite big, and we may not be able to reach out our arms around the stomach because the abdomen is big. Okay, so that time what you have to do is you have to give chest thrust. Okay, instead of abdominal thrust in pregnant ladies, we give chest thrust. So you have to put your hand at the base of the breastbone, just above the joining of the lowest ribs, like the way it is shown in the pic, and then give the thrust. Press hard, inward, upward with a quick thrust. Okay, so the action will be same as the Heimlich maneuver. Only thing is, instead of the abdominal thrust, you are going to give chest thrust. In case of pregnant ladies, as well as in case of people who are obese, because we may not be able to reach out till their belly button because of their big tummy, central obesity, we may not be able to reach out. So that's why what we do is, we'll reach out till their breastbone, lower part of the breastbone, and then we are going to give abdominal thrust to dislodge the choking object. Okay, just imagine you are alone and you're choking. Then how will you do? There's no one to help. You can perform Heimlich on self as a self-rescue. Okay, so how to do it? You have to perform the abdominal thrust on yourself by using your hands against a chair, a counter, or an edge of a sink, whatever is available near you. Okay, you can take the help of a chair or a counter or the edge of a sink. So what you have to do is, you have to place the fist above the navel while grasping the fist with the other hand and leaning over the chair or the countertop, whatever is available, and drive your fist towards yourself with inward and upward thrust. Okay, this is how you can perform self Heimlich maneuver for self rescue when there is no one available till the medical help arrives. This is how you have to stand behind the person who is choking. When the person is in a standing position, you will stand behind the person, and you have to keep one foot slightly in front of the others for your balance. Okay, because you should not collapse, right? To perform Heimlich maneuver in children, it is the same, but The only two differences are, like for a child you have to kneel down, obviously because their height is not same as the adult, then you need to kneel down. Okay, for a child you have to kneel down. And the second difference is the pressure should be gentle. Okay, the pressure that you are going to use should be firm and gentle to avoid damaging the internal organs. Okay, so you don't require as much pressure as you require for an adult for giving abdominal thrust. Okay, and remaining it's all the same. As you can see here, this is how we'll perform Heimlich maneuver in children. So Heimlich maneuver in children and adults, it is almost the same. Only thing is, for children you have to kneel down a bit, and the pressure that you're going to apply will be gentle so that you don't damage the internal organs. Next, how to help an infant who's choking. It is not same as in adult or children. There are 3 steps in this. First thing is, when you see a baby choking, first of all, see, they will not be able to clutch a baby. You have seen the universal sign of choking, right? So you will not see a baby clutching their throat with their 2 hands. Then what will be, how will you confirm that the baby is choking? You can confirm that the baby is choking by seeing that the baby is not able to cry or make much sound, weak or ineffective cough, soft or high-pitched sounds while inhaling, difficulty breathing, ribs and chest is retracted, bluish skin color, and loss of consciousness if the blockage is not cleared. Okay, so these are the signs of choking in infants. When you see the baby is choking, the first thing what you can do is, if you can see the choking object, in the mouth, if it is visible, and if you can put your finger around it and be able to remove it if it's only in the upper airway, then you can do that. Okay, with the finger swipe you can remove the choking object. No, if it is quite deep, you will not be able to reach it out, or there is a risk that if you try to remove it, it can get inside more. Then that time what you have to do is, you have to give 5 back slaps and 5 chest thrusts to the baby to dislodge the choking object. Okay, so how to give the 5 back slaps and 5 chest thrusts? Let us see that. To give back slaps to the baby, back slaps, which is also known as back blows or back thrust, what you have to do is, as you can see here in the pic, you have to place the baby with the face down on your forearm and grip their jaw with your hand, and rest your arm on your leg or on the lap for support, and with the heel of your free hand you are going to give 5 forceful and rapid blows between the baby's shoulder blades. Okay, so this is how you are going to give back slaps or back blows to the baby. Then once 5 back blows or back slaps are done, you will turn the baby around and you will give 5 chest thrusts. How you will give 5 chest thrusts? Like this. So 5 chest thrusts. First, position and support your baby on the lap and place 2 fingers on the center of his or her breastbone, just below the nipples, means about 1 finger breadth below the nipples, and then give 5 quick chest thrusts. Okay, the force you exert should be like, it should be pressing half of its depth, half of the depth of the chest. Okay, so this is how you are going to give chest thrust to the baby. So you are going to repeat this cycle: 5 back blows, 5 chest thrusts. This is one cycle. Then again you will check whether the choking object has been dislodged. If it has been dislodged and if you can see it easy to remove, then take it off with your finger. And if you still think that there is a risk of pushing it further down, then again you will continue back slaps and chest thrust. So even after 3 cycles, if you are not able to dislodge the choking object, then immediately you have to get emergency services. Okay, so it is a medical emergency. So you have to continue to perform the back blows and the chest thrust, continue to perform this cycle till the blockage is removed. Okay, so this is how you are going to perform Heimlich maneuver in infants. May it be an adult, pregnant lady, obese person, child, or an infant. When you are performing Heimlich maneuver, if it fails, usually it has a success rate of more than 86%. But if it fails and the person loses consciousness, then and becomes unresponsive, then immediately please start standard CPR. And always before performing Heimlich maneuver also you have to call for the help. Okay, until the medical team arrives you can continue doing this cycles to help the person who is choking. It makes a big difference, okay. So we all must be aware of this maneuver because it can be helpful to us. Any person, anytime, anywhere they can choke, and if we know this maneuver and if we can do it effectively, we can save the life of a person, and we can make a difference. Okay, so hope this video has helped you in understanding how to perform, when to perform Heimlich maneuver. Okay, and if you liked it, if you found it easy, then please do subscribe, like and share my videos. Thanks for watching, and keep learning, keep growing, stay physically, mentally and spiritually healthy. Keep smiling, don't fight, and stay connected with Nurses, the Heart of Healthcare. Thanks for watching.